Today I'll be talking about the concept of congruence as popularized by Carl Rogers in his seminal paper in 1957. In this paper, Rogers described 6 conditions, one of which was congruence, that was necessary and sufficient for clients' therapeutic transformation and healing to occur. Rogers defined congruence as when a therapist is genuine or integrated, meaning real, authentic, and honest. It's someone whose inner experience, their feelings, attitude, and beliefs are aligned with their actions. A congruent therapist is not someone who's wearing a mask or pretending to be an expert with all the answers or saying what they think they're supposed to say. Congruence is about the therapist being real, being freely and deeply themselves in the session. A congruent therapist is transparent. Doesn't mean that the therapist impulsively discloses everything they're thinking or feeling, but rather they remain connected to what's happening within them. Congruent therapists are honest and transparent only when it is therapeutically relevant and appropriate for the client. Congruence involves the therapist's awareness of their own feelings and attitudes in the moment, especially those arising in a therapeutic relationship, such as a lack of empathy or a lack of unconditional positive regard for the client. Acceptance is owning those feelings rather than denying or distorting them. And it's not about perfection. It doesn't mean that the therapist is always going to be calm, positive, or insightful. And congruence requires ongoing self-work, which involves ongoing reflection and supervision. Congruence is important to a therapeutic alliance. When therapists are genuine and transparent, clients feel they're in a safe environment where they can open up without fear of judgment. It's what builds trust, and it allows for deeper emotional exploration to happen. Congruence strengthens the bond between the therapist and the client, which is associated with better therapy outcomes. Clients are more likely to be open and authentic when they perceive their therapist as genuine, and this mutual authenticity facilitates relational depth and deeper healing. It allows the client to reconnect with parts of themselves that may be disowned or denied, especially if they've had to hide who they are to be accepted in the past. A congruent therapist provides a consistent and reliable presence which can be healing for clients who've experienced inconsistency or betrayal in relationships. Congruence models what warm, respectful human connections can look like. And when therapists are authentic, clients are more likely to feel empowered to take ownership of their own healing. Being congruent aligns with the ethical principles of integrity and self-awareness outlined in the PACFA Code of Ethics, ensuring that therapists present themselves authentically to clients. There are a number of risks to be aware of when a therapist is being incongruent. For example, clients may sense that something's not right, and this can erode the client's sense of safety and therefore trust. Incongruent therapists may miss or misread emotional cues from clients, leading to poor attunement. If a therapist is perceived as guarded or inauthentic, clients may become guarded themselves and self-protect by raising their own defenses. Therapists who suppress their feelings or present a false front may experience burnout over time. Clients may misinterpret mixed messages or emotional inconsistencies from the therapist, leading to some confusion and potential ruptures in the relationship. And we know that congruence has been linked to a better therapeutic outcome, so without it, therapy may be less effective overall. Unlike empathy, little research has been done on the concept of congruence. Colden et al. In 2018 conducted a meta-analysis on 21 studies looking at the relation between therapist congruence/genuineness and client outcomes. The client outcomes they looked at were symptom reduction, improved psychosocial functioning, well-being, and various measures of life satisfaction and psychological health. They found a link between congruence and client outcomes that was moderate but statistically significant on the following things: that there's a positive impact of congruence on client outcomes when therapists were older, had more years of clinical experience, or were fully licensed. The type of license, whether it was a psychologist or counselor, had no bearing on the outcome. There was also a positive impact of congruence on client outcomes for group therapy versus individual therapy, and assessments of congruence conducted multiple times during therapy showed a stronger association with positive client outcomes than those conducted only at the end or after therapy. So by 1980, Rogers said that congruence was the most important of the Rogerian facilitative conditions, which makes a lot of sense why it in fact is located across so many different theoretical orientations and therapies, although sometimes it can go by different names or be described differently. For example, it's not unusual for a congruent therapist to be described as someone who's genuine, authentic, real, honest, transparent, forthcoming, and so on. So what I'm left with is that congruence transcends theory. It seems to be a way of being that is a part of all humans, and we're all capable of connecting to that part of us, which is why it can be located in so many theories. After 15 years in the counselling field, I've come to see that it's not just techniques or theories that create change. It's me showing up as myself with presence and honesty. When I'm congruent, I'm modeling what it looks like to be real, to be human, to be integrated. Clients sense that I'm not performing a role but truly connecting. They see it in my eyes, in my posture, but more importantly, they feel it. And in that space, they begin to trust me, the counselling process, and themselves. One of the biggest challenges I've had to confront is my increase in disability, which has shifted how I see myself and how I work with clients. Staying congruent has involved staying honest with myself and authentic with others, even as my capacities, emotions, and self-perception shift. It's not about disclosing every detail to clients, but about ensuring that what I present and feel are not disconnected. Congruence has shaped my personal life too. I was raised in a family where I was encouraged to hide my feelings and not speak my truth in case I offended others. It would have been more helpful if I'd been taught to speak my truth respectfully, honestly, with courage and care. Getting to know myself, acknowledging when I don't have all the answers, staying attuned to what's alive in me emotionally has helped me show up more fully in my relationships. Congruence has meant not hiding my struggles, but embracing them with humility, grace, and transparency. In a way, congruence has become my inner compass. When things feel off, whether in a session or in my life, I feel it in my body. It's an inner knowing, a gut sense that's always been there and been honed through years of practice, helping me to stay grounded. So as I grow older and face increasing challenges and navigate our fast-changing world, continuing to grow personally and professionally helps me stay connected, adaptable, and relevant. And by staying congruent, true to my values, honest about my experience, and open to change, I can meet these challenges with authenticity and integrity. Some opportunities that might help me continue developing my congruence include supervision. At this stage of my career, I do not want a supervisor who focuses on my technique or skill correction. I want the space to explore and recalibrate my congruence, particularly as my personal and professional circumstances change, so that I can maintain an authentic, ethical, and meaningful practice over time. I want the space to address my changing values that are likely to evolve as I age and go through life transitions. I want the space to re-examine the balance between professionalism and authentic presence, to address countertransference that affects my congruent relating. I want to examine my difficulty being congruent in power-laden contexts and address the grief, adaptation, and redefinition required as my mobility continues to decline while trying to maintain professional continuity. I also think reflective practice groups would be a great opportunity. Participating in peer group supervision with experienced counsellors who speak honestly about their struggles and how they manage their personal lives in difficult counselling sessions would be an enriching and enlightening experience. I think carving out time for myself to be still and quiet would also be helpful. Being a sole working mother, I'm always busy. It's important that I set aside time for solitude, journaling, or reflective meditation to get in touch with the real me. I need to reconnect with my why, not just why I became a counsellor, but what called me to this work. That place in me is still alive, even if it's quieter now. To let myself go back as a way of reconnecting with myself would be a wonderful thing. So congruence isn't something to master and then move on from. It's my lifelong journey, and every step I take toward greater alignment will emanate from me and touch those around me. My clients will feel it, the people in my life will feel it, and I will feel it.